Hello, good morning everyone. I'm Dr. Catherine Christina John and I've done my BDS in CSI CDSR, which is situated in Madurai, and I've done my oral implantology, a complete certificate course in MS Ramaya, Bangalore, and I've got a very good opportunity working with Dr. Sunil in Richardsons Dental and Craniofacial Hospital in Nagercoil. So right now I'm here to talk few things about dental implants. So what is dental implants? It is a titanium material which is inserted into the jaw bone and acts as a root for the missing teeth and acts as an abutment for the prosthesis. So we usually do a conventional method. So what we exactly want when we are planning to place an implant. So the first thing we need to do is taking a proper case history of the patient and the intraoral examination and check with the radiograph with CBCT and OPG. Children cannot go for dental implants. That's because the incomplete growth and the development, and the patient who has got chronic disease like diabetes and leukemia or etc., they are not a good candidate for placing a dental implants. The quality, the standard of the implant matters a lot. So there are hundreds of companies implants, but choosing an implant, the quality, the standard of the implant is a very important thing for long lasting and for patients. Patient satisfaction is more important than anything. One tooth is lost, not only the tooth but also the surrounding structures like bone and the gums. So we concentrate not only the teeth but also the surrounding structures of the bone and the gums. Of course, implant cannot last for long, like lifelong, but they can if it's maintained properly. There are compromises and failures along the way, but if the maintenance is proper, yeah, it can last at least for 15 years and even more than that. So what we need to do for that is like a proper treatment plan. A treatment plan is a very essential thing we need to do. And the dental hygiene, it's not only about placing an implant but also after placing an implant. So we need to educate the patient about the oral hygiene, visiting the dentist, like follow-up appointments and etc. So after planning the treatment according to the measurement, we decide the size of the implant. And finally, we're going to give a crestal incision, raising the flap, placing an implant from the pilot drill into the cortical bone till the final drill. Always the final drill should be less than, the size should be less than the implant size. The primary retention is a very important thing we need to concentrate. The torque should be at least of 30 NCM. So in anteriors, we're placing an implant. There should be at least 2 mm below the crest of the bone for better aesthetic prosthesis. Better looking prosthesis and natural looking prosthesis. We suture up and we place a cover screw. We suture up, and if it's necessary, we place bone grafts or PRF, a membrane if there is a defect in the bone. And we recall the patient after 2 to 3 months of time. If it's a healthy patient, if the healing process is faster, yeah, we can start the second phase as soon as osseointegration. Each patient, it differs, the healing process differs. So it might take even 6 months of time for the healing process. According to that, we can start the second phase. So what do we do in the second phase? We give a small incision where we place an implant and we expose it, we remove the cover screw, we place a healing abutment and leave it for a week for creating an emergence profile. Emergence profile is for a better and natural looking prosthesis. So after that, impression is taken and the final prosthesis is done. What do we do for the long-term care? So we need to educate the patient about the oral hygiene, advise them to keep their oral hygiene like properly, like brushing twice daily, flossing, and whatever we do for our natural teeth, the same way they have to maintain the dental implants. Regular follow-up is very essential long-term care. So thank you so much for listening to me patiently, and see you very soon in the next video. Bye.